Hello everyone, my name is Rupali Dakwe, and today we are going to talk about the scenario that we also saw last week about this newborn mom, a young mom who is a homeless, and we are going to talk about the postpartum pain management for this patient. So, if I have to be a nurse of this patient, I should keep in mind that the first and the foremost thing I would keep in my mind is I should not carry any preconceptions and biases about anybody. I would enter the room as I would enter any other patient's room and greet them. I would listen to them. I would understand. I would ask the patient if how she's doing, and if patient says she's in pain, I would assess for her pain further. Like I would ask the questions about what is the numerical scale, what the intensity of her pain is, where the location of the pain, what type of pain it is, and I would also ask for her preference of the pain medications. I would not keep I would not keep a preconception about that the patient is a drug abuser and she might ask for pain management all the time, because that's one thing we always think, that because the patient is on drugs she probably might need the pain no matter what, pain medications no matter what. So for this patient, the nurse has to be knowledgeable about the pain and the management of the pain. We all should know that after pains, which are crampings, usually are very common in during the during the contraction of the uterus that occurs in days following the childbirth. They are normal but can be more or less intense based on every patient, and usually are strongest during initial second and third day following the delivery. We also should know that if the patient is breastfeeding or on any uterus contraction medications, the contraction of the uterus, the breastfeeding causes the contraction of the uterus, and every contraction is like a cramping pain, which is like a childbirth pain, more or less. So we have to be educated about, we have to make ourselves educated about this first, that there is a pain, there is actually a real pain after a baby is born. Also sometimes if there is a newborn mom, like sorry, if the mom is if the baby is her first baby, then they can have some tear while delivering the baby. Also they can have the incision if the baby is too big. The doctors make this episiotomy, which is an incision at in the vagina, and that can be painful. It can be very irritating. It can burn during urination. So we can ask the patient what kind of a pain management she would like to have, what are their preferences, and see if there is anything ordered, or I would give the patient ibuprofen as prescribed. Also, if depending on the level of the intensity of the pain, if it is more severe and if it is not controlled by ibuprofen, I might want to call the doctor and get order for little better higher intensity drugs um, like maybe Percocet, or if not then maybe oxycodone. Patient might have a C-section. In that case the pain level would be even worse. So I should keep in mind that they might even need IV morphine or IV Dilaudid. So based on the assessment, I would assess the patient first, and based on their assessment, physical and psychological assessment, I would see what level of pain and what patient's needs are, and the vital signs. They're tachycardic, or the blood pressure is high. I know that this patient is in pain. So also I would keep in mind some of the non-pharmacological pain managements, like I would ask patient to use the same relaxation and breathing techniques that are used during the labor or the childbirth that can alleviate after pains as well. Maybe I will ask patient to walk. That can help a little bit. Uh, Keep bladder empty because the pressure of the bladder can cause the pain too. Um, Also, other non-pharmacological pain managements like some if they with the chair or the episiotomy, they might need seats baths that are ordered. So I would arrange for the seats baths. Um, I would see if they need some ice packs. That's a good pain management as well. Um, Sometimes they might, other than the actual pharmacological pain managements, they also can you can also assess that they might need some understanding the social or the emotional spiritual needs of the patient. You can ask the patient if they could be religious, so you could ask the patient if they need some pastoral care services. You can call them and ask the patient, ask the pastoral services to come and see the patient, talk to them, sit next to them, and communicate with them. Um, Sometimes sharing their unique experiences, the communication, the therapeutic touch, showing compassion, just sitting beside them, listening to them. Sometimes they just want them to be listened to. Um, they don't have anybody around them, so they might want somebody to just sit and listen to them. So that kind of helps maintain the bonding between the nurse and patient, and also maintain their dignity. That this nurse is not a judgmental, she is a non-judgmental, she is ready to listen to my problems, and that pretty much is very important for this kind of a patients. um, Interpersonal communication, patient-centered care, um, in engaging them into conversation and making them feel that you are listened, also, and then working towards togetherly towards a mutual goal of um, bringing them a good pain management, giving them a good pain management, thus helping people to come to their own understanding how to deal with the problems, how to deal with their own pain, and what they're gonna do, what their plan of care is after they go home and get discharged. So this is like developing, I would say, developing, being culturally aware and developing um, culturally congruent care to these patients will um, kind of help the patient and the nurse to come to a common grounds, and that would help a better pain management. If you take everything together and integrate that into their into the plan of care, then I think both ways it's going to be benefited to the nurse and the patient as well. Thank you very much.